Hello, today I'll be sharing briefly about my research project looking at the association between prenatal chemical exposures and the odds of substance addiction service utilization. My name is Yvonne Fan, and I am a fourth year public health sciences student, and my faculty mentor is Dr. Veronica Vieira. My research interests include environmental epidemiology and maternal and child health, so I'm super excited to share more about my project today. So here's a question for your consideration. How do prenatal environmental exposures affect risky health behaviors in later years? In our project, we want to find out how exposures to neurotoxic chemicals can be associated with drug use behavior. Existing research indicates that prenatal neurotoxicant exposure can alter levels of sensation seeking, impair response inhibition, and increase impulsive responding. We can be exposed to these chemicals from our built environment, and I implore you to think about how some communities are more affected by poor infrastructure and increased industrial activity due to historic zoning laws and prejudice. So in our study, we are looking at the New Bedford Harbor Superfund site, which is declared by the Environmental Protection Agency as contaminated by hazardous material, which is obviously concerning for the communities surrounding the site. So the communities in the New Bedford Harbor are exposed to bioaccumulative neurotoxicants, such as lead, mercury, DDE, and polychlorinated biphenyls. Risky substance use is also a significant public health concern in the United States, with the medical costs associated with substance use disorders and inpatient facilities eclipsing $13 billion in 2017. So for our study, we use general additive modeling, which is a form of semi-parametric regression. Preliminary findings indicated that lower DDE exposure is stronger when modeled in a mixture with lead, and that the odds of substance abuse service utilization decreased with increased DDE levels, regardless of lead levels. This is interesting, as previous research indicates that DDE is a risk factor instead of a protective factor. So more research is needed to determine why this might be the case in our study. Overall, I do want to emphasize that this study is unique because there are not many studies utilizing general additive modeling to characterize associations between prenatal exposures and substance use disorders. Also, the Superfund study area provides the possibility of not only characterizing the socio-demographic risk factors of risky substance use in later years, but also distinctively the prenatal exposures to environmental pollutants, which many times is a result of environmental injustices and systemic racism, as I hinted at earlier. So ultimately, I hope our findings can help inform public health strategies and address substance use risk and environmental exposure reduction in New Bedford Harbor and beyond. That's all for today. Thank you so much for listening.